There is asymmetry in my upper eyelid. Any treatment would you recommend? This is post an injury in childhood. As I age, the asymmetry is becoming more and more visible. In the morning when I get up, it is not as bad, but by evening, the situation worsens.
Thank you for your question. You submitted a photo, and in your question you're stating that the eyes are asymmetric, and this is related to a childhood trauma, and that it is becoming more and more obvious. So let's start by first defining what is the, quote, asymmetry. And from the photo you submitted, it looks like the right upper eyelid is lower than the left upper eyelid. And when we refer to eyelid position being lower than you want, we call that ptosis. Ptosis basically means drooping. So when it's eyelid ptosis. And it is not an unusual history. When there is trauma and the eyelid swells tremendously, then there can be some stretching of a muscle. The part of the muscle that stretches is typically the levator aponeurosis. The word levator is like the word elevator. It lifts the eyelid. Now, traumatic ptosis can sometimes mean stretching or dehiscence or separating. And what that essentially means is that it is possible that you can benefit if for cosmetic reasons and maybe for functional reasons, depending on how low your eyelid becomes, to correct the eyelid so that it looks more like the other eye. Ptosis surgery, it basically is to deal with the muscle and to place the muscle in a way that elevates the lid and creates a contour so that it looks more symmetric. Just to give you an idea of how we do this as a cosmetic oculofacial plastic surgeon, I do a lot of ptosis surgery and have done a lot of ptosis surgery. With adults, what we do during the surgery is we'll actually do the procedure and have the patient sat up during the surgery to try to get that height and contour right. The muscle is a very sensitive muscle in terms of how it responds. You can have the eyelid too low or too high or not get the right contour. This is a specialized procedure and is generally performed mostly by oculofacial plastic surgeons who are trained in a specific way through fellowship training, and it really is remarkably tricky in that you want to be able to make it as predictable as possible. Occasionally a patient can have the eyelid too high or too low. It's referred to as undercorrection or overcorrection. But going back to the asymmetry, again, the reason first of all, the asymmetry is referred to as ptosis. It is probably, if it's related to a trauma that was due to facial swelling, it's traumatic ptosis, and it is correctable for the appearance and to maximize the symmetry, and that understand that how we do this in our practice is to do this with local anesthesia, light intravenous sedation, which means that you won't feel anything. I should have mentioned that earlier, is that when we're doing the surgery and we sit you up, you don't feel anything. It's not like you have an awareness of any discomfort, but when we're able to have you open and close your eyes and look down and up, we can really customize and adjust appropriately, and it results in a pretty high rate of success and satisfaction. So I think at this point you should go and meet with qualified, experienced, most likely oculofacial plastic surgeons. I think you really need a specialist for this type of surgery. There are other surgeons that do this, but most people, the majority of ptosis surgery still, I believe, is performed by cosmetic or reconstructive oculoplastic or oculofacial plastic surgeons. So meet with some doctors, see what the likelihood of the predictability of the surgery is, what method of surgery. There are a couple of different options. but it essentially involves the levator muscle. Some people would do something called a Mueller's muscle resection or shortening, and that's also an option. Depends on the physical exam. And so the photo is helpful for coming up with some kind of diagnosis, but a physical exam is still necessary to determine muscle function, height, and variability, and to come up with a treatment strategy that makes sense and will result in a desirable outcome. So I hope that was helpful. I wish you the best of luck, and thank you for your question.